Hi, this is Brian Kim. I'd like to share with you my approach towards cortical cleanup, the easy, safe, and efficient way. So think about the capsular bag, the empty capsular bag with only cortex inside it, as if it's a uncooked pie dough that's contained within a tin shell. And think of the shell as the posterior capsule and the cortex as the uncooked dough. Well, as you can tell, the uncooked dough, it conforms to the shape of the shell. And so the context of that also means that the dough itself, as in its entirety, provides some structural form and shape and integrity. And so you can imagine extrapolating that to the cortex. If you remove most of the cortex in front of you and leave the sub-incisional for last, you're basically removing the cortex, which again provides some structural rigidity. You will have only the remaining posterior capsule, which is only a few microns thick. And so when you go after the sub-incisional cortex, you're having the remainder of the posterior capsule, which is flopping around, and as the fluid in the eye is fluctuating in pressure, the posterior capsule can jiggle around, and as a result you can tear and capture the posterior capsule. And so the alternative, which is the better way, is to always start with sub-incisional cortex, because you know that the remainder of the posterior capsule is going to be held back by the remainder of the cortex. So I always start going down into the left, and I sweep side to side with the curved INA tip, and then I increase vacuum linearly, and as I gradually increase, I catch the capsule, the cortex, and as I sweep side to side, it loosens the cortex, and I'm able to remove it. I go up and around clockwise 270 degrees, down into the right side, and I repeat the same thing along the sub-incisional area by increasing vacuum linearly, swiping side to side, and as I grab the cortex, I pull it out. Now, grabbing the cortex in front of you is easier. You want to grab the cortex and sweep side to side in a large fanning motion. And as you do that, it will slowly liberate the cortex, and you'll be able to remove it in one large piece. And this is much better than what some people do, is when they grab the cortex and using high vacuum, they pull it centrally, or just using the vacuum alone to strip the cortex. The problem with that, it's much more uncontrolled, and you have a higher risk for grabbing the posterior capsule. But if you grab the cortex and sweep side to side under more moderate, lower vacuum, you can actually loosen it mechanically rather than using the high vacuum, which I feel is safer and provides a much more controlled method. And when you remove in this fanning movement, you're able to remove large quadrants of cortex, in my experience. So this is our first example. I've turned the tip downward and to the left. I'm engaging the cortex. You see my vacuum, it's rising gently. I'm swiping side to side, and I'm able to remove that small area of cortex. I go down and to the right, and I'm going to do the same thing, sweeping side to side, increasing my vacuum to remove that cortex. Once the sub-incisional is out, the rest of this is fairly easy, but you're going to see I'm going to use this side to side swiping motion, and that really helps loosen the cortex in an easy way, because you're able to remove large chunks of it all at once. So again, I'm going to go down and to the left, and don't be scared of catching the posterior capsule, but it's very hard to do that. You're going to grab the cortex because that's right in front of you, and remember, the remainder of the posterior capsule is held back by the cortex. So go down and to the right and do the same maneuver, and I'm sweeping, and then the cortex in front of me, in this case, there wasn't much to remove. It was all fairly loose, and it just came out, and that was fairly uneventful. Now this is where I actually have a small thin layer of epinucleus, and so I don't just have cortex, but I have a thin layer of epinucleus, and this is what happens when you inadvertently hydrodelineate. I don't hardly ever hydrodelineate because it just creates this extra step of removing epinucleus. So again, you see this large area of cortex in front of me. I'm going to start on one end and I'm going to sweep all the way to the other side, and I snagged both sides, and you saw I was able to easily remove that. Again, I was on fairly low vacuum numbers. If you want to review that again, the vacuum numbers are fairly low when I make that sweeping motion. Again, I think that's safer because you're less likely to snag and break the posterior capsule. So again, I got the subincisional out. Now I'm going to attack the part in front of me. I'm moving side to side in a fanning motion, trying to get large quadrants of cortex, and boom, it's able to just come out fairly easily. Now this is a small pupil case, and again, just to reiterate that just because the pupil is smaller doesn't mean we have to do any different maneuvers. You're going to go subincisionally, sweeping side to side, and then go down to the other side subincisionally, perform the same maneuver, so you have a fairly good area of subincisional area that's been removed. And then you're going to do this, again, side to swipe sweeping motion on this cortex in front of me. And you want to do gentle, again, on fairly low vacuum settings, you're able to grab the cortex. So for those of you who still struggle with having these little pieces of subincisional cortex, one thing you can do if you don't want to do this is you can go back with OVD, and then using a sweep like a Singer sweep, go through the second side port incision, the paracentesis site, and you can sweep the capsular fornix, and you'll be able to liberate that fairly easily. The other option is using a dry aspiration technique. Thank you for your attention, and I hope this was helpful to you.